Well, good morning, everyone. It's 11 o'clock on Friday, and we're so pleased to have so many of you with us today. Thank you for joining us for the vaccinations, the science behind them. My name is Beth Baker, and I'm the Aging in Place Navigator for the Forever Dublin Hub. And this is kind of my plug for the Hub. If you have questions about resources to help you age gracefully in your home, please contact the Forever Dublin Hub, and I'd be very happy to help you. The Forever Dublin Hub is so pleased to host Dr. Michelle Taylor and Dr. Angel Prim from Ohio Health. They're going to be speaking today on vaccinations, the science behind them. And I wanted to clarify, this is not about the COVID-19 vaccination. It's an overview of vaccinations. If you have questions, you can put them in the chat box, please. I do also want to let you know that this is being recorded. So if you don't wish to have your photograph on the screen, I did want to let you know that it is being recorded. Dr. Michelle Taylor is a board certified MD with the family physician and faculty at the Dublin Methodist Family Medicine Residency Program. She's from Hilliard, Ohio, and completed her medical training at the University of Cincinnati and Riverside Methodist Hospital. Her medical interests include women's health, community medicine, wellness, and pediatrics, and she lives with her family in Powell. Dr. Angel Prim is a second-year family medicine resident physician at Dublin Methodist. She's from Alliance, Ohio, and completed medical school at Ohio University Heritage College of Medicine. Her medical interests include geriatric medicine and preventive medicine. So please welcome Dr. Michelle Taylor and Dr. Angel Prim.
Thank you, Beth, for that wonderful introduction. I'm going to go ahead and share our PowerPoint here. And can everyone see the screen okay? Maybe Beth, a nice nod there.
Yes, I can.
Wonderful. All right, so again, thank you for having us to give this presentation on vaccines. As Beth stated, this is not specific to the COVID-19 vaccine, although we do mention it in our presentation, and if there are any questions, we would be happy to answer what we can at this time. Again, this presentation is not specific medical advice to any individual. This is, if you do have questions regarding your individual health circumstances, contact your family doctor would be the best route to go. But we can answer some general questions for you and hopefully give you some information on the science behind vaccines. Our learning objectives for today, we're going to talk about different types of vaccines and how they work. We're going to list the various vaccines that are recommended for adults specifically, because I do believe everyone that is here today is an adult. And then we're going to briefly describe the COVID-19 vaccine that is available currently. So Dr. Prim's going to start us off by some basics of what vaccines are.
We can't hear you.
There we go. I wasn't being allowed to unmute again. Okay, here we go. So vaccines are products that are developed to stimulate your own immune system to provide you protection from specific infectious diseases. They contain that virus or bacteria, either weakened or inactivated or partial, just pieces of the specific virus or bacteria they're protecting you against. And most are injected into the muscle, which is called intramuscular, with a needle. You usually get that in your arm. Other modes of transportation can be oral or intranasal, which is a nose spray. And those are only a couple of specifics. So how do vaccines work? Our immune system is made up of two branches, the innate immunity and acquired immunity. So innate immunity is the same for every person, unless you have a specific deficiency, and it's made up of some cells such as neutrophils, monocytes, natural killer cells. Some of these may sound familiar to you. These are really good at finding, engulfing, eating, killing very small microorganisms, but they're not great for everything. So that's where our acquired immunity comes in. And your acquired immunity is going to be different for each person. It's based on what you've been exposed to in your lifetime. And it's made up of many types of cells, but specifically B cells, which are responsible for creating antibodies. So what are antibodies? They are a protein molecule that's created to attach to a bug. And that works because on the surface of every bug, virus, or bacteria is also a protein molecule called an antigen. And this antigen is specific, like a signature to that specific bug. And so the B cell is responsible for finding the antibody that fits on that antigen. So finding the antibody to fit the bug, has to find the specific one to connect to it, and then that sets off a cascade, inviting other immune system cells to the area to eventually kill that bug. And once that's all done with, that the winning B cell that had the correct antibody is stored as a memory B cell. And that way, the next time you're exposed to that bug, you already have the correct antibody picked out, stored with that B cell. Similarly, you have T cells as part of your acquired immunity, and these are the killer cells. So similar to antibodies, on the surface of a T cell is a protein molecule, and it fits onto a bug, similar to an antibody, in the way that it fits onto that signature on the bug surface. And the T cell can directly kill that bug. There are also helper T cells, which provide some assistance. And then again, memory T cells. Once you find the winning one, he's going to be stored long-term so that he's ready to fight the next time you're exposed to the same bug. So how do vaccines actually work? It's like training the troops. Once you are injected or introduced with the that weakened or partial bug, your body starts this process of finding the right B cell, finding the right antibody, finding the right T cell in order to fight that bug, and then storing that as memory in case you're actually exposed to that bug later. So it's a process of training the troops. And why is this important? Because there's a delay that happens for the time that it takes to find the right antibody that fits and find the right T cell that fits, and then create enough of those to fight the bulk of bug that's invaded your body. That delay can be several days, and that can put you behind on how much time it takes you to get better. But once you have those memory cells stored, it shortens that time down significantly, because then all you have to do is pick that guy out of his, where he's waiting in storage, and then start replicating the antibodies and replicating the T cells. It's a much faster process and much more efficient.
So that way, if you're vaccinated for a disease, your body can almost immediately begin to create antibodies and potentially kill that disease, that virus or bacteria that's invading your body, so that you don't develop the disease. So that we kind of nip it in the bud before it even becomes an infection in your body. So that is a very detailed overview of how vaccines work. Thank you, Dr. Prim. If you have any questions about this, we'd be happy to entertain. And there's a lot more that goes into this. This is a kind of a very, very brief overview. That is why we go to medical school to learn this. So as Dr. Prim alluded to, there are different types of vaccines to mount that immune response within your body. And I've listed most of the different types of vaccines here. So we'll go through each of them. A live attenuated vaccine is a weakened bug, so a weakened virus that is then introduced into your body, whether through a shot or through a nasal spray or an oral vaccine. So that you actually do get some natural infection. However, the bug has been weakened to the point that it doesn't actually cause a major illness in you. So usually you might have some very mild symptoms of an illness after a live attenuated vaccine, but you don't get the full-blown illness that you would. Some examples of live attenuated vaccines would be the old shingles vaccine, Zostavax, and the chickenpox vaccine that we give to children, as well as the measles, mumps, and rubella vaccine that we give to children. So those are live attenuated vaccines. Again, it's a live virus, so your body does mount a full immune response to this viral infection. However, the virus is weakened to the point that it doesn't cause severe illness in the vast majority of individuals, like it would if you got infected with the actual bug. The next type of vaccine is actually the most common type, an inactivated vaccine. And that can be a whole virus or a whole bacteria that is then killed. So it absolutely cannot cause infection. It's killed. Your body still notices that you're being injected with something though. So it recognizes that there's foreign viral particles in your body and you mount an immune response. So those B cells and those T cells, and you develop antibodies so that if your body does get infected with that organism in the future, the real live organism, it does recognize it. Kind of a subcategory of that would be a subunit vaccine. So inactivated vaccines, you just take the whole virus or the whole bacteria, kill it, and then introduce it. Subunit is a little bit more specific. You take the specific proteins from the virus or the bacteria that are most likely to cause an immune reaction, and you purify those specifically. So usually those, again, there's no possibility of causing any disease because you're, again, just injecting a protein. It's not any virus or bacteria that can cause disease. But again, you develop the antibodies to that so that your body will recognize it. The best example of a subunit vaccine would be the hepatitis B vaccine, which most children get now, and some adults get as well in high-risk categories like healthcare workers and patients with diabetes. Now, the mRNA and DNA vaccines we've heard a lot about recently because both of the COVID vaccines that are approved in the United States are mRNA vaccines. These are interesting. So an mRNA vaccine specifically, since that's the one that's available right now, is genetic material that is taken up by your cells, and your cell actually makes that protein. So instead of injecting the protein, like with a subunit vaccine, your cell actually does the work to make that protein. And that's the case because sometimes with viral infections, your body will be able to get rid of a viral particle without necessarily having that specific immunity. And in this particular case, we really want your body, for the COVID vaccine specifically, to be able to clear that COVID infection on its own. So your body makes the protein, and then your body's immune response responds as it usually would to make antibodies so that if you did get exposed to COVID, for example, you would be able to mount that immediate immune response. And then lastly, there's a type of vaccine that's called a viral vector vaccine. There's only one vaccine that's like this, and it's the Ebola vaccine, so it's not particularly relevant in the United States. But essentially, they made a virus completely, they removed all of the infectious parts of the virus that causes disease, and they inserted in some genetic material of another disease so that the benign virus will replicate within your system, and then you will mount an immune response to it. Again, potentially, if you got exposed to the actual disease in the future, you would be able to then fight it off. But I would not worry too much about the viral vector diseases, the viral vector vaccines, because there are not many on the market. One of the COVID vaccines that is being developed, but is not one of the ones that is actually approved in the United States yet is a viral vector vaccine, but I would not focus so much on those. Usually the top 4 are the ones that adults are going to be immunized with in the United States. So obviously there's a lot of science behind how vaccines work and the different types of vaccines, but I know that a lot of people have questions about how vaccines are developed. So there's a lot of different phases involved in the development. So discovery and preclinical, that's identifying the disease. So identifying the virus that causes the disease, identifying, are there certain proteins that this virus makes or that this bacteria makes, and how do we target it? What kind of vaccine are we going to do? Are we going to try and make a live attenuated vaccine? Are we going to try and make an mRNA vaccine? What's the goal here? And then we go into the clinical trials where these are tested in humans. I forgot to say in the preclinical phase, that is where any animal testing will occur. And then there's 3 different phases of clinical trials, and I'll go more into that on the next slide. That's where the vaccine is tested in humans to determine the appropriate dose, to determine is it safe, and to determine is it effective. After 3 phases of clinical trials are completed, the FDA in the United States will review all of the data from the clinical trials. And there's a lot of talk about, since pharmaceutical companies who make immunizations are the ones that conduct the trials, they actually give their raw data to the FDA to review so that the FDA is an objective observer to determine, did this vaccine actually prevent disease? Is this vaccine safe enough that we can give it to the general public? And then once it's approved by the FDA, it is given to the general public, potentially in phases like the current COVID vaccine is. And then there's monitoring afterwards, since there's going to be a lot more people that get the vaccine. If there are any rare side effects that come up, a lot of times those are going to be identified in the post-approval monitoring phase. So for example, I got my first COVID vaccine a few weeks ago, and I signed up for a vSafe app from the CDC so that I can tell them, did I develop any symptoms after I got my COVID vaccine? Luckily, I did not. So I didn't have much to report to them. And if anybody did, they would be able to report it. There are multiple different ways that you can report adverse vaccine reactions. Going back to the different phases of clinical trials, just in case you're interested, phase 1 is, very, very small trials that's primarily focused on safety and figuring out an appropriate dose. So are there any big side effects that happen when giving this vaccine, or do we need to, what kind of dose do we need to give to people to mount an immune response? Phase 2 is a little bit bigger, so more people are involved. Once we figure out that it's safe, we're not seeing any crazy side effects in the small number of volunteers, we ramp up the study to include more people to, again, study the safety. Are there any more side effects that come out? And then we do blood tests to determine are people that are vaccinated mounting an immune response, yes or no. Finally, in phase 3, which is even bigger, we will study, does the vaccine actually prevent the disease that we're looking for? And this is where we continue to determine, are there major side effects? Are there any safety concerns? But the primary goal of phase 3 is to determine, is this effective? Is this something that is actually working? We can test antibodies in the blood all we want, but the real value in a vaccine is preventing disease or preventing severe disease. So those are the 3 different phases of trials. Again, everyone's talking about the COVID vaccine, so the 2 that are approved in the United States have been through all 3 of these phases. Moving on, Dr. Prim's going to talk about what vaccines are recommended for adults.
Okay, so several vaccines recommended for adults. First off is the Tdap or tetanus vaccine. It's actually a combination vaccine. It includes tetanus, diphtheria, and pertussis. So tetanus is a bacterial infection that can cause or that causes muscle stiffening. It's particularly dangerous because it causes stiffening of the respiratory muscles, and then you can't breathe, and it's a very deadly bacteria. You can get it from typically from injury with contaminated, usually a metal like a nail or a sharp piece of metal. It can also be ingested in improperly canned food items, like botulism can also be from improperly canned foods. So tetanus is one component of this vaccine. Also pertussis, which is whooping cough, which we mostly hear of in babies. So you would get 1 dose of the full Tdap vaccine in adulthood, and then you need a booster every 10 years because we find that your immunity wanes for this, and you require a booster about every 10 years. That booster can either be just the tetanus or it can be the full Tdap. Most offices and pharmacies really just carry the Tdap, so that's most likely what you would be receiving. Next would be at age 50, you become eligible for the varicella zoster or shingles vaccine. Shingles is the resurgence of the chickenpox virus that you have that you can get as a child. Most of us had as a child. And rather than completely going away, that virus remains dormant or just sleeping in some of the nerves that are alongside our spine. And so it can actually be reactivated later on in life, usually as we get older and our immune system is a little bit less robust than it was as a child. And it then exhibits usually as a painful rash, burning, stinging, aching, and even after the rash resolves, you can have nerve damage that continues to cause pain afterward. So the shingles vaccine is protection against that resurgence of the chickenpox. Next would be the pneumonia vaccine, a pneumococcal. There are two versions of this, 13 and 23, and the number refers to how many strains of pneumonia it protects you against. So you get a pneumonia vaccine as a child, and so the recommendation has recently changed. It previously was that you would get pneumococcal 13 at age 65, and then 1 year later you would get 23. And the 13 at age 65 acted as a booster to the childhood vaccine. We're finding now that the childhood vaccine has been so effective that you don't necessarily have to get that booster of pneumococcal 13 when you're 65. You could actually just skip it and go right on to 23. It's still recommended to have a conversation with your doctor about it and consider getting it. And for any of my patients that have chronic diseases, diabetes, any immunocompromising disease, congestive heart failure, COPD, anything that would involve their lungs, I still recommend that they get this as a booster just because they're vulnerable, they're more vulnerable. So that's the pneumonia vaccine. And then finally, your annual influenza vaccine against the flu. So we recommend that to all adults once a year, beginning of flu season, usually sometime between October and December, to really get the vaccine in before the season really hits, which is typically December to March, November to March. And that vaccine is a little bit different every year because the strain of flu that comes out every year can be a little bit different. And so that's the reason we have to get it every year. You have to make sure that you're vaccinated against the particular strain that is coming around for this year.
Thank you, Dr. Prim. And I saw at the beginning that there was and I haven't been looking at the chat, I saw at the beginning there was a question about which vaccines require boosters. And the shingles vaccine is a 2-dose series. So you get 1 dose, and then you do need to get a booster 2 to 6 months after that first dose. And then the pneumonia vaccine, it depends on whether your doctor decides you need the 13 vaccine in addition, but that would be a booster 1 year later, or potentially if you got a pneumonia vaccine before you were 65, sometimes then it would be 5 years after your first dose, you would get a booster. But definitely talk with your doctor about the specifics about when you would need a booster for the specific immunizations that you've had. And there are other vaccines that are recommended for adults with certain health conditions. These are the most common ones. These ones are recommended for all adults, but there are some very specific medical conditions that require you, that we would recommend additional immunizations.
Dr. Taylor, there was a question in the chat box.
Okay.
At age 85, would it be important to get the shingles vaccine? It says age 50, 85. How does that play out with age?
So, and Dr. Prim can add to this certainly. I recommend all my patients over the age of 50 to get the shingles vaccine. So if you're 85 and you have not yet had the shingles vaccine, I would recommend that you get the 2-dose Zostavax inactivated shingles vaccine, because as you get older, you are more susceptible to shingles. Again, for your particular situation, I would recommend that you consult with your family physician or internist. But my recommendation for my patients is anytime over the age of 50, if you haven't had those shingles vaccines, that you get them. Dr. Prim, I don't know if you had any additional considerations.
No, only that you can get shingles at any age, and you become more susceptible the older you are and the less robust that your immune system is. And so I would definitely recommend, depending on your health conditions and if you have any reason not to get it, which you would discuss with your own primary care doctor, but I would recommend for any of my patients 85 without any contraindications that they would get the vaccine at 85. And that's the Shingrix 2-dose vaccine.
As a follow-up to that, if you did get the old shingles vaccination at age 50, 52, what happened to that? What was the science that kind of failed us on that?
Yes, and thank you, Dr. Prim, for correcting me. The Shingrix is the vaccine that is recommended now. So the old vaccine was Zostavax. That was a live vaccine. And we actually found, despite the fact that it was a live attenuated vaccine, that it caused a lower amount of immune response. So we talk about percentages of efficacy. The old vaccine, Zostavax, was around 50% effective at preventing shingles, whereas the new vaccine, Shingrix, is over 90% effective at preventing shingles. So we do recommend, even if you had the single dose of Zostavax, the old shingles vaccine, that you do get vaccinated with the new shingles vaccine, Shingrix. All right. Moving on to the COVID-19 vaccines, and I'm sure there will be many comments from the and questions from the audience. So just a brief overview. There are currently 2 approved under emergency use authorization in the United States. There's a product from Pfizer and a product from Moderna. Those are 2 different pharmaceutical companies. Both of these products are mRNA vaccines. So we talked briefly about how those worked, and I've got a couple of slides with some infographics if you're into pictures about how they work. They both are a 2-dose series. So the Pfizer vaccine, you get 1 dose, and then 3 weeks later, you get a booster. And then the Moderna vaccine, you get 1 dose, and then 4 weeks later, you get a booster. So usually about a month in between the 2 vaccines. These vaccines have been studied. Like I said, they've been through all of the phases of clinical trial. And based off of the clinical trials, they are about 95% effective at preventing severe COVID-19 infection, which is pretty effective when it comes to vaccines. Now, it hasn't been studied necessarily in terms of the ability to transmit COVID-19 person to person or some other endpoints, but the first thing that we cared about in the healthcare system in the United States is are people going to become severely ill from COVID if they're vaccinated? And with these vaccines, again, all of the data is pointing towards it being extremely effective. Here's a fun little infographic if you're really into this about how these new mRNA vaccines work. mRNA technology has actually been around for a while. It just has not been used in an immunization until this COVID vaccine. So again, there's some genetic material that codes for a certain protein. Your body takes in the genetic material for the mRNA from the vaccine into the cell, not into the main part of the cell where all of your genetic material lives, but just into this outside part of the cell. And then your body will be able to create that protein and develop antibodies against it, so that if your body does become infected with COVID, you will have those antibodies and that acquired immune response ready to go to fight it so that you don't become severely ill. All right, you don't even need to read this. I just thought this was really cute. That this is actually a 9-year-old rendition of how mRNA vaccine works. This is not a 9-year-old that I have anything to do with. I found it on Facebook. And I know that when I was 9, I had no idea what mRNA was. So this is a very smart child. And again, like I said, there were 2 vaccines that are currently approved in the United States. There are some other COVID vaccines that are in the works that may be approved in the future that work in different ways. And there's different storage requirements, there's different efficacy. So we're really just waiting on those trials to be completed and for the FDA to review those trials to determine are other vaccines going to potentially be available in the United States. Briefly, I'm sure you've all seen the different phases for a COVID vaccine within the United States and within Ohio specifically. We're currently in this phase 1A where healthcare workers and nursing home residents and workers are able to get vaccinated. And we will soon be moving into phase 1B where older adults and those with chronic medical conditions and those who work in schools will be able to get vaccinated. And actually just yesterday, we received some of the details about when that might happen. So if you are age 80 and older, you will be eligible for the COVID vaccine starting Tuesday, January 19th, which is very soon. And then each week, kind of the date decreases a little bit. So January 25th, if you're 75, and if you have certain high-risk medical conditions, February 1st, age 70 and older, and then February 8th, age 65 and older. Now, the distribution plan for where COVID vaccines are going to be given has not completely been finalized. There's some health systems like Ohio Health, OSU, Mount Carmel, et cetera, will likely have vaccines available. But in terms of where you would necessarily go, it's not necessarily going to be going to your doctor's office like you might for a flu shot. Additionally, pharmacies will likely have vaccines in stock, but again, the details are incredibly fluid and rapidly changing. So over the next week or a few weeks, we should be getting more information as to where you can get a COVID vaccine if you are eligible.
There are a few more questions.
Yeah.
Thank you so much for that presentation. Very clear. I did want to reiterate that this presentation is being recorded. So if you want to refer to some of the slides that Dr. Taylor and Dr. Prim presented, you can go to the hub and review the presentation there. It will be up probably within a week or so. We'll edit it and put it up. We did have a question, and it's specifically regarding COVID-19. Who should not get the COVID vaccine at this time? Is there any category of persons that would apply to?
Dr. Prim, do you want to take this or do you want me to?
Sure. I believe the recommendation is only for anybody who's ever had an anaphylactic reaction to a vaccine in the past, or if you're allergic to any of the components of the COVID-19 vaccine. And the list of ingredients is available on the CDC website.
That is completely correct. And it's actually, if you go to the CDC website and you look at the COVID-19 vaccine page, it tells you a specific list of contraindications. And it really only is anaphylactic allergy to any of the components of the vaccine. If you've had an allergic reaction to another vaccine, you have to consult your doctor as to whether that is something for you. Now, I will say, if you have specific medical conditions, it's always a good idea to ask your doctor whether this vaccine would be recommended for you, because your doctor knows you best. They know all of your medical conditions, and they might be able to tell, are you in one of those high-risk categories that we would recommend getting the vaccine even earlier.
This also was another question directly, basically towards the COVID-19. If someone had COVID, how long should they wait before they get vaccinated?
That's a really good question. The current recommendation is as long as you are out of quarantine, so you have had your 10 to 14 days where you are in quarantine and you are safe to go out into public to the location that you are going to get your vaccine, you can get your vaccine. And we've actually had one of our doctors who had COVID be able to be immunized with the first dose of the vaccine once their quarantine was over. So the current recommendation is even if you had COVID 2 weeks ago, as long as you are out of quarantine, we do recommend that you get the immunization if you are eligible.
Something that you may have heard additionally is a recommendation to wait 90 days. That's not actually the recommendation. It is to go as soon as you're safely able to discontinue quarantine. But the 90 days is because we found that you typically have immunity. Your antibodies to COVID-19 are typically lasting about 90 days. So you technically have your own immunity to COVID-19 for about 90 days after you've been sick with it. That doesn't mean that you can't get the vaccine. It's just one of the things that's out there, as you already have antibodies for that period of time.
Yeah, it is rare that you can get reinfected with COVID within that 90-day period. However, there have been a few case reports of that happening. So what we would encourage our patients to do would be, as soon as you feel well enough, you're out of quarantine, you have the availability to get the vaccine, that you would receive it. But of course, again, speak with your individual situation with your physician.
So then just to follow up, this person had 3 or 4 questions embedded in one, specifically related again to COVID. If you, we have the 2 shots that you're receiving within 4 weeks of each other. Is there speculation that will need a booster in the future, or is kind of like the tetanus that will need a booster, or is that not the case?
We do not have enough information to determine that at this point in time, just because COVID and the immunizations have not been around long enough to determine the level of immunity that is lasting. Additionally, as you may have been seeing, there are viral mutations, which happens with any virus. It mutates over time. That's how it works. And viral mutations might happen, so that we need to create a booster that's more specific for the version of the virus that is around, a year from now or 2 years from now. We just don't know. Now, I did see in the chat that there was a question about the new strain of COVID that has been discovered. And I will say that the belief currently is that the current COVID vaccines that are available should cover that strain. There's no reason to believe that that was not the case, because the genetic coding for the part of the protein that the vaccine creates an immune response against is the same.
There is another question also for someone facing non-elective surgery. They're over 70. Are they able to get in a vaccination in a category sooner to get the vaccination?
It's all based off of those very specific recommendations. So for someone between the age of 70 and 75, it depends on what medical condition you have. So if you have a specific high-risk medical condition, you should be eligible January 25th. If you're between 70 and 75 without one of those specific high-risk medical conditions, you should be eligible February 1st. That's unfortunately, it's hard to make public health recommendations for the very, very specific individual circumstances. But that is actually really soon, so I'm very hopeful.
And so maybe just to recap then, I see another comment. There's another strain out there. We don't know how effective the identification of the vaccination will be. Is that correct? I mean, we have
the new strain that is out, we have no reason to believe that the vaccine is not going to be effective against it. Because again, vaccine creates immune response against certain parts of the virus. The part of the virus that has changed is not the part of the virus that the immune response is directed against. So we have no reason to believe that the new strain that is currently going around, again, as of today, January 8th, 2021, would be something that would not be covered by the vaccine.
And I think if I just may say in a broad sense, it seems that vaccinations help our body recognize foreign material. That's the whole premises behind a vaccination, is to help us recognize, hey, there's something bad here.
Yes, and sooner.
And sooner.
Because if you wait for your body to recognize it until you already have a full-blown infection, that's when you get severe consequences of disease.
I like that idea of training up your army.
I love that, Dr. Prim.
I do too. I use it with all of my patients. It's something we all can understand. It's universally understandable.
Keep the army in tip-top shape.
That's right.
I don't see any additional questions. If there was something that we missed.
I did see something here from Tam. Once we receive the COVID vaccine, how long should we wait before we can consider it being active or effective? There is some information on that. If you have received both doses of COVID vaccine, I believe the data from the trials showed that within 3 to 4 weeks, you should have that 95% protection, again, against severe disease. It doesn't necessarily mean you can't acquire the virus or that you can't transmit the virus to others. We don't have that information as of yet. So, again, that's data from the trial. We should have more population level data as more people get the immunization over the coming weeks and months. And I will say, even if you've been vaccinated, we recommend wearing a mask when you're out in public and social distancing. That does not change any of those recommendations.
Hopefully we'll have a better flu season. People will be wearing masks and being social distancing. So hopefully our flu season will be minimal as well.
It's actually quite surprising how few cases of influenza have come out this year. And I think it is because people, for the most part, are being serious and wearing masks, washing their hands, social distancing, staying out of public.
Well, I think this concludes our presentation, and I thank you so much for Dr. Michelle Taylor and Dr. Angel Prim for being with us today.